A warm-hearted welcome to the video tutorial of Honigum Pro. Even today, the topic of impression taking in dental practices is still an item for which the dentist has to make compromises. So far, there has not been any material on the market which is really ideal for what the dentist really needs. The dentists are always on the lookout for the ideal impression material. This leaves him with materials from alginates, C-silicones to polyethers and a wide variety of silicones, especially A-silicones. Even though the path can really be quite easy, it now leads directly to Honigum Pro. Why is Honigum Pro the ideal impression material? Let's look at some more details in the next few minutes. I would like to give you an overview as to what kind of material properties make the new Honigum Pro ideal for the dentist. With all our experience, we have developed a new and unique formulation. This means we have a rheologically active matrix, a kind of crystal matrix, enhanced with the latest fillers. This is done to ensure excellent mechanical properties in flowability and stability, which the dentist can even feel during the treatment. The material itself knows when it has to be stable or where it has to flow. Honigum Pro features intelligent flow on-demand characteristics. So what exactly is this thing that we call the matrix? Up to now, we are more familiar with the term as something virtual. Our matrix is, however, tangible and for our Honigum Pro light shown schematically here. This interlocking within the crystal structure ensures his stability, which is intended in the region of the preparation, especially after the application. The material stays where you want it to stay as long as you want it to stay. But as soon as you exert a force on the material, it immediately starts to flow. The force is referred to as shear stress. You have shear stress during the treatment, for example, when the material contacts the teeth. When the crystalline structure mentioned is overloaded by shear force, spontaneously the crystal align and allow flow of the material. But as soon as the shear stress stops, this grid will immediately change back into its random form and obtain the same stability as before. The advantage for the dentist is that the material remains stable in any situation and just where he needs it. Just like here in the area of a single preparation or like here in this simulated veneer treatment. Honigum Pro allows the dentist to syringe the complete situation without the risk that Honigum Pro will start to drip or will not remain in the place the doctor liked to take the impression. If you want the material to penetrate into deeper areas, for example, when your preparation is deeply in the sulcus, you can do this with Honigum Pro. On the right side, where the airstream strikes the material, as you can see here on the picture, you can clearly see real waves in the material, but only in the exact spot where the force of the airflow strikes the material. It's flowable. On the left side, where there's no shear force coming from the airstream, the material remains stable. It does what you want. The Rheological active matrix causes the property of Honigum Pro light, outstanding stability and unique flowability in one material. The superb properties of our patented material can also be represented graphically, and in the chart you can see the highest values indicating in the excellent stability of Honigum Pro versus those of its competitors. Under shear stress, when the impression is taken or moved with an air blow, Honigum Pro has an excellent flowability and has attained the best values in the chart compared with the competition. This other case will show you the benefit of Honigum Pro once again. The advantage for the dentist could be shown very easily. Very ordinary impression materials may not be flowable enough to get into the areas desired, and that could make the impression inaccurate. Honigum Pro is the ideal impression material for you. Every dentist knows that during the impression stage, the question of how the material handles moisture usually means making compromises again. Just as these footprints on a wet beach fill up again with the ocean water from underneath, you have the similar phenomenon in the mouth. Here you can find it around the tooth and particularly in the area of preparations. The continuously flow of sulcus fluid creates a real problem for some impression materials. The solution here is again Honigum Pro. In order to prove the ideal behavior, we put it to a test with the help of a Sulcus-Fluid-Flow Model developed by Professor Wurstmann at the Justus Liebig University in Gießen. The purpose of the experiment was to establish the behavior of impression materials when confronted with moisture during the application phase, and to determine the impact on the achievable margin integrity of the restoration obtained from the impression. The experimental setup includes the idealized preparations to simulate a wet sulcus. Here they have used different kinds of light-bodied materials, and Honigum Pro Light was the reference material. The yellow and the red line represent the bottom of the sulcus. It can be seen very clearly that Honigum Pro Light completely reaches the base, even through some areas only in a thin layer. The competitor material does not perform as well. It remains visible above the line. Here you have a better view over the thin layer of Honigum Pro Light. In this diagram, the depth of penetration is again very clear. Honigum Pro is a material you can trust in making impressions around wet areas, even in the deeper part of the sulcus. We have to emphasize another advantage associated with moisture. Let us clarify two other terms: hydrophilic and hydrophobic behavior. It is usually measured as a contact angle. Hydrophobic behavior, which means that just as a drop of water apparently does not like the surface, it tries to make a little contact as possible. The angle of the drop of water in relation to the surface serves as a measure for the term. If it's greater than 90 degrees, it is defined as hydrophobic, or if the water wants to spread over the complete surface, creating an angle of under 90 degrees, it is defined as hydrophilic. No matter which stage of the curing process we look at, Honigum Pro is consistently described as hydrophilic. Unset, we have an angle of 43 degrees. If set, the contact angle is 80 degrees. The hydrophilicity is important for the dental technician as well. To produce the gypsum model, watery suspension of gypsum are used. If these come into contact with a hydrophobic surface, the gypsum may not be able to fill all areas. As a consequence, we see bubbles or voids in important areas like the preparation margins. Therefore, with its hydrophilic properties, Honigum Pro also supports the dental technicians. Another ideal property of Honigum Pro helps dentist and dental technician with the following problem. If you, for example, have to prepare in the depths of the sulcus, or the patient has a periodontal disease, there's a risk that the light material could tear during the removal of the impression. If there are any undiscovered small particles, this can lead to inflammation. This tearing can also happen if you want to remove the impression from the model, which makes it impossible to cast another precise copy. For dentist and technician, this is a really annoying point and leads to an increased workload. This material property is called toughness. To describe the toughness of a material, we need two properties: the tear strength and elongation at break. which we simulate and measure in this device. We need a combination of two important factors. How much power can I exert and how stretchable is the material without tearing. The higher the value measured with this machine, the higher the toughness. Compared to comparative materials, Honigum Pro has once again come out with excellent results. A safe removal of the impression out of the mouth and from the model is now assured. The curing behavior of usual impression materials puts the dentist under pressure, as curing starts once the material is extruded from the mixing tip. So, as time progresses, the flowability decreases and makes getting a precise impression more difficult. With Honigum Pro, the ability to flow extraorally stays constant for 2 minutes and 45 seconds. A special advantage, you do not have to wait the full 2 minutes and 45 seconds, but by inserting the tray into the patient's mouth, you start the following 3 minutes and 15 of intraoral setting time. A snapset effect can even be felt because the material sets very fast at this point. In implantology, impression materials must meet special requirements. The position of the implant in the mouth of the patient is transferred to a model in the laboratory by transfer posts. Ideal flow behavior and ultimate strength are required to assure that the transfer post is in the same three-dimensional position in the impression as in the mouth of the patient. Here again, we have the ideal impression material within the Honigum Pro family, the Honigum Pro Heavy. The flow properties of Honigum Pro Heavy makes the syringing around and over the transfer post unique, easy and ensure with its final hardness of 68 Shea hardness a safe transmission of the position of the transfer post with the impression. The perfect flow properties and final hardness assist the dentist and technician with implant impression as well. You know the many different materials with many different setting times, working times, and even if you want to go faster with Honigum Pro, you have the ideal impression material. If you look at the working times, you can see that for all Honigum Pro mixture materials, we now have the same intraoral setting time of 3 minutes and 15. And once it has to go faster, we have all variations in a fast version as well. The setting time in mouse is only 2 minutes and in our putty fast hand mix version even only 1:45. For a complete recovery after deformation of the impression, please give it 30 minutes. I hope you enjoy the Honigum Pro family, and I want to say goodbye with a very nice impression of Honigum Pro. Thank you very much.